Hello, my name is Eva Niyibizi. I am an emergency and internal medicine specialist, originally from Rwanda, grew up in Belgium and the United States, and trained in Belgium, Switzerland, and Israel. After 10 years working in academic urban centers and as an ED attending for almost 4 years in that setting, early last year, I felt it was time for a change. I now work part-time in a private community emergency care with a center with teaching credentials. And earlier this year, at the perfect time of the first wave of COVID, I opened my own private practice. It has been sometimes an uphill battle with lots of falls, but I did learn a lot, and I would love to share my journey with you, hoping that this experience may one day help you. So I will talk about 5 points. The first one is what is private practice in emergency medicine. The second one is it even feasible in our context? The third part that I would address is my personal motivation to take this bold step. And then the last 2 aspects would be about the early pitfalls, challenges, and I will end on a good note with what have I enjoyed so far in terms of promises. So what is private practice in emergency medicine? Starting private practice is a bit like starting a business. And some of us weren't thought about the practical business side of medicine. And I personally always have a conflict of morality of seeing patients as clients, because I believe healthcare is a fundamental right. However, emergency medicine is great because it is a very wide specialty with a lot of different alleys in terms of how to practice it. You can do inpatient private ED consult, or you can do ambulatory emergency medicine care. The main advantage of working in emergency medicine is that you already have the patient pool that comes from the ED. That's where you see them, and you don't have to advertise too much about your practice to find incoming patients. And I do believe that for patients, it gives them, we get a better quality of care because they have a better follow-up after their ED consult, and it can help make the ED less crowded. So the second question is it even feasible in our context? So part of this answer is really personal, and I advise you first to check the regulations in your country to see if you can actually have a license to practice outside of the hospital. You have to educate yourself on changing tax status and a lot of administration and legal requirements before you actually decide to go ahead. However, more and more these days, we see that there is the tendencies to build a collaboration with the public and the private sector as partners. You can, of course, decide to not do it alone, but create a medical group with a multidisciplinary team with different skills, a nurse, a gynecologist, a pediatrician, you, a nutritionist, you know, however you see it, if you find partners that you get along with and that you share the same vision. One major point in terms of feasibility, of course, is money matters. I personally didn't ask for a loan, although I could have. I had some professional savings, and I did start really, really small in terms of investment. I really just focused on basic furniture, computer, you know, the program, basic material. And of course, in that, I think the biggest cost would be if you were to acquire an ultrasound machine, because that really gets the cost up. But I would say don't worry, because usually banks tend to lend to doctors or professional healthcare providers who start their own practice, because it is a very low risk of bankruptcy type of business. So what was important for me was really to find a rent that wasn't too expensive and to have at least one colleague with whom I could share, the same financial optics, who was a little bit more senior, and so who had already been there, and someone that was not interested in making profit off of my work. So in order to reduce cost and allow myself more flexibility, I have installed telehealth and video consult shifts. I have an online program for an online agenda where people can just book appointments anytime. They can leave me a note. I have a remote telesecretary and, of course, a telephone line where you can be reachable. And I use a lot of emails, so that just reduces cost. So in all of that, of course, is the main point of financial literacy. I think it's necessary in terms of feasibility, and it's definitely, for me, a big challenge, because I believe that most women may not really have a sufficient financial literacy, and it literally takes away some of the power that we could have. So I advise you to learn accounting basics, to make a business plan, to find an accountant, to learn to understand what you're talking about, and to see if you need an investor, to look at all of the different insurance plans, of course, make sure you understand them, that you're not just signing things off. And if you do need to hire someone, for all of these things, when you're really starting, it's really important to talk to people who have done it before, get multiple opinions, and see what they did, where they went, and compare and educate yourself on that. So yeah, financial literacy is key. I cannot say it more. I think location matters. Location matters because you can either decide to set your private practice adjunct to the ED or to another hospital structure, or you can do it, in an urban or in another location or rural area. It's always good to have some lab or radio facility not too far, so you don't have to do it everything in your own office. But it's in the location. It's important that it's easily accessible for patients, that it's somewhat attractive, and that the area in itself is not too saturated with doctors. But then you also try to see which other practitioners, healthcare practitioners are around you, and develop your community network the same way you do in the hospital. And I think it's really important also to keep a hospital reference where you send your patients, and so that you actually keep the network that you already know, and your patients get a better quality of care. So this is for me, in terms of feasibility, what's important for you to remember. The third part will be what motivated me to take this bold step. My main motivation was really to gain more flexibility in my own time management and more autonomy, in order to also do my own activities in my advocacy work, my volunteer work, of course, my family life, get a better personal health and work-life balance, and really, really reestablish a good sleep cycle. What I really enjoyed is that because the private sector is more innovative and more reactive to implement change in the professional environment, I have now more bandwidth to implement new projects, and I'm happy about that. So when we talk about early pitfalls and challenges, there are a lot, but I think I would say there are three of them. The first one, which is a professional deformation, is my lack of patience. I've always been used to working in a team where things are done quickly, and I personally want everything to be done quickly. So I'm used to working very fast. And in this new setting, when you build something from scratch with no experience, it really takes time, patience, and a lot of humility, as not many things are in control in the beginning. And it's sometimes 12 times harder than I thought, but I'm getting better at it. A second really tough call was discovering all of the hidden tasks that are usually done by clerks, nurse, the cleaning, laboratory, administrative, secretarial job, material, the material maintenance, making commands, all the safety procedures, all of the things that, we usually do as a team, and that I personally didn't have I had no expertise on them. So now all these new job skills are things that I'm learning, and are very different from just doing medicine. And I would say that sometimes I do miss the big ED cases, or the big adrenaline rush. And I was really scared of losing my skills so quickly, since I wasn't so much applying everything that I knew and that I was trained to on a daily basis. So so for that, one important advice that I would give you is to keep an in-hospital activity part-time, and to stay updated. So you don't feel too left out on rounds or lecture. You do the podcast, talk with your colleagues, go to the rounds, and that also helps you get a better care for your patients. So I would finish with on a good note, with what I've enjoyed in terms of promises. The main gift and reward has been the privileged patient relationships, and actually having time to listen to patients. It has been my greatest joy. I have patients now who can talk to me, who are not all inebriated. They can listen, they can follow up orders, you can see improvement, and that is really, that's great, because it touches our human heart as caregivers. And being able to give more of who I am and not just what I know, which is actually something that frightened me a little bit before, where I was mostly happy not having continuity of care. Most of the things, beside my own, the emergency problem for which the person came, were like not my problem. And I actually used to hold a bit of a skeptic attitude towards primary care doctors. And I really thought I would be bored and I would only see runny nose and depressed people. But I proved myself wrong. And maybe there's a time for everything, but I've discovered a lot of things, and I'm still discovering each day. And actually, with our ED training, we do a lot already of frontline primary care, whether it's social, physical, mental health. We are the interface between the outer world and the hospital. So here in my private practice, I'm still a gatekeeper. But instead of just finding the best orientation for my patient, and after they leave the emergency room, I still advocate for them, and I help them stay as healthy as possible. I support them still in their own context of life, and I help them navigate the healthcare system, which can sometimes be so brutal and complex at times when one is vulnerable or not connected from the inside. So yeah, now my goals went from getting people out of the ED as fast as possible, or keeping them alive when it was sometimes often too late, to now keeping them as healthy as possible and out of the hospital, which is a big challenge, and it makes sense, especially now during this COVID pandemic. So the last thing that I would say was in terms of growth and maturity. I have acquired a lot of that by just learning to work for myself and with others, and not just working for others, or with difficult colleagues without a way out. I have more autonomy. I am more responsible, of course. And that brings that has definitely made me grow a lot into my own voice, into the fact that, you know, I realized where I was censoring myself before, and now places that I can actually authorize myself to be more bold. I'm happy that I still get to do, you know, I'm still, although I'm not in an academic setting, I still have a lot of academic engagement in the teaching. I have students and interns who come into private practice, and I also see them in the ED. So I have not lost that bit. So I'm very happy. So this is my personal experience. The last thing that I just wanted to add is that you don't have to be a doctor to start a practice. You can be a nurse or a physio, someone with, you know, I don't know, good IT or tech abilities, and then you can, if with the network that you have in your experience. I know one nurse who started an online platform for telehealth pediatric consultations, and she's very happy with it. She uses her skills and her network, and she actually contributes to making the ED less crowded. So in the end, it is about thinking a little bit outside the box. And if you have an independent or adventurous spirit, or if you are a little bit bold, or you feel like it's something that talks to you, then, you know, maybe this entrepreneurial gig can be attractive to you. And I am more than happy to answer, talk to you, or listen to any comments or thoughts that you might share. And I'm always available. Yeah, so you have my contacts, reach out, and good luck.